Hi, I'm Dr. Sumanth M Shetty. I'm a clinical director of Chisel Dental Clinic, Bangalore. Sterilization in dentistry. Sterilization is a removal of all forms of microorganism from the surface of an object. Sterilization is important in dentistry as dental instruments come in contact with stains, blood, and other biological fluid. So, the chances of transmitting this bacteria or germs from one person to another person is common if sterilization protocol is not followed. Sterilization kills, deactivates, and eliminates all forms of life and other biological agents like germs and bacteria. So, mainly there are three types of sterilization. First is with high temperature, low temperature, and liquid chemicals. In high temperature, we can use autoclave, steam sterilization. In low temperature, we can use hydrogen peroxide or pulsating light. And in liquid chemicals, you can use chemical sterilization agents, some liquids to sterilize the object. So, steam autoclave is one of the most preferred or effective way of sterilization for dental clinic. So, the pressure steam in autoclave can get rid of all types of microbes and spores from the dental instruments. There are 8 steps for sterilizing dental instrument. First is transportation of the instrument to the processing area. Second is sort instrument and dispose of waste properly. Third is clean instruments in an ultrasonic cleaner. Fourth is rinse and dry instrument. Fifth is packaging of the instruments. Point 6 is sterilizing instrument in a sterilized unit like steam autoclave. Point 7 is store instrument in a dry and protected area. You can use UV chamber for it. Point 8 is review sterilization process for quality assurance.